At a time when normalcy gradually started limping back into our country, the second wave of COVID-19 that struck India weeks ago has left the government in shock as the transmission rate is faster compared to the first wave. Similarly, in Meghalaya, a state known for its tourist destinations, the spike in the number of COVID-19 cases worries not just the government but all the stakeholders, including the business and tourism sectors. The Northeast Today spoke to a few stakeholders to get their views on the prevailing situation in the state. But before we get into that, let us look at where we stand right now as a state and a country. So far, India has registered over 3.14 lakh new cases of COVID-19 only in the last 24 hours, the highest number of new cases registered in a single day since the outbreak of COVID-19 pandemic in the country. With this, cumulative positive cases crossed the 1.59 crore mark. Now, what is this new variant of COVID-19 that everyone is talking about? What worries health experts is the emergence of this new variant scientifically known as B.1.617. It was reported that this new variant is the cause of the record surge in infections in the country, though the government is yet to confirm it. According to reports, this new variant that has the so-called double mutation was first reported late last year by scientists in India. India's health ministry first acknowledged the presence of a double mutant at the end of March. These are the E484Q and L452R. Two mutations come together in the same virus. But reports have it that a new triple mutation have been reported in India. Coming back to Meghalaya, the alarming surge in the number of cases has sparked fear and concerns amongst the citizens. As of April 21st, the state registered a total number of 1,021 active cases, with 14,130 recoveries and 157 deaths. Recently, Meghalaya Chief Minister Conrad K. Sangma had stated that the rise of COVID cases in the second wave is 6 times higher than the first wave.
The number at which and the pace at which things are growing is very, very high. So therefore, we need to act right now. The two most important things to do for the state and for the people is number one, obviously maintain the behavioral change and the protocols, and number two is to take the vaccination.
What is the difference between the first and second wave? Surgeon Superintendent of Shillong Civil Hospital, Dr. Andreas Dikhar, said that in the first wave, the transmission rate is slower, but severity rate is higher. But in the second wave, the severity as such is a bit less, but the transmission rate is very fast.
To get this number, what we are getting now, getting the new case now, we took only hardly 20 days from March till now. Whereas to get the same number last year, we took almost 4 or 5 months. So it means the spread is very fast. That wave, not from our hospital, we have not sent any samples for, to test the strain or the thing, but maybe, I don't know about the district or the state might be they have sent, or maybe we can suggest them now. If we have plenty of cases, then we can suggest them to send at least few samples for testing of the mutants.
Let me break it down for you. In the first wave, transmission rate is slower, severity rate is higher. In the second wave, transmission rate is higher, severity rate is lesser. In the first wave, symptoms are fever, dry cough and tiredness. But in the second wave, symptoms are fever, dry cough, tiredness and also loose motion. In the first wave, virus attacked mostly the elderly and people with comorbidity conditions. In the second wave, the virus attacks everyone irrespective of their ages. More cases reported amongst young people. How do common people see this surge in the cases? Let's have a look.
College kacancatan nomor ba ngi dan praktikal ai ngin supay kumtung im nops tour radang yo ban le pada hapo lab be tangi kham tour kan teteng kumtu dengan le online kalong cancate ngi nomor ban kontak ikino kai im to hap tek sap hap phone iki kan kham cancan ma dang yo pat ban entak iki mar khamat face to face ka kham sup tengi
ti kai ka bakongsan menta kalong ba ngin le kat bala ban ban eye awareness ikibrio khnang bakin pikir ya kani jingpang ngakir patru ya baro kumba ka government hi kala ai kani ka vaccination yang athrai kala don kam yang i wpi we bangin hap ai kani ka vaccination khnang banyada ya kini kijat jingpang kiba nakapor kinang por.
I think that as long as we take precaution and trust the government, there is no need of any fear. Because like our world, we have faced like this kind of situation in the past, like example like the SARS. So I don't think there is any need of any fear because we are all educated people and we know what to do. So that's all.
Is Meghalaya prepared to tackle the second wave? Health officials said that at present, Meghalaya has a sufficient supply of medicines and medical facilities to handle the situation.
We know it is spiking now, but the government and the health department is prepared for any kind of eventuality. So we will not make any, the situation that will happen that will not be able to tackle the COVID-19 in our state.
Prepared means right now we are prepared for, here we have only 40 beds. Maybe Saudi we have nearly 60 beds or something. Oxygen right now we are okay. We still have, just now the supply came, we are arranging the oxygen. Hope we won't be short. But it depends on the surge, how much the surge will come. Now I have got 40 beds here. Now if the surge come, then I have to close the other building. So another 40 beds or something will come up. So who knows that if real surge come, we have already prepared that we may have to close some of the hospitals and make it a COVID hospital.
Why the surge? There are various factors that contributed to the surge in the number of cases in the recent weeks, and complacency is one of them.
I mean, you go to market side, you go to the roadside, you go to the area where people gathers, weddings and all, or somebody died. You go there, you will see nobody is using masks. So if they are not using in crowded place, we can think what they will be doing at home also. So I think unless the people take up this, because this advice is still standing till now also, that at least use mask, hand washing and social distancing, these three things are to be maintained.
As of now, Meghalaya is not looking at another lockdown, but apprehension looms large as the business and tourism communities struggle to recover from the losses suffered during the lockdown imposed last year.
If you have 100% watertight, airtight measures, I do not see a problem if a tourist enters the state. If there is another lockdown, it will be a huge impact. I think the state government should be ready with relief packages. Without relief packages, I think stakeholders in the tourism sector, especially in the rural areas, will not be able to survive. Most of them were compelled to take loans to pay the electrical bill. So now with another closure, I think they'll not be able to even pay the loan that they've taken. Whatever loss that we had experienced last year will take 1 or 2 years for us to recover fully.
Basdam usnap ngalatip baja kamni. Tingam jusa ban lumbri hang ni. Kamde si ko percaya bang nyak kamban kedai kamban ihap ban perkat dami kiwe.
Song nirun song hayeng ra mlang ra ngi hablai kuni ada wan bela kuni kacung bela kam da kotu ra la su ya den maren ni sa khau khun da ai bat khun tirun ban dai dam ya la ji ngi kum kepara.
We are not going for the lockdown at present. But if the situation arises, okay, but now we are going to see also the livelihood of the people. If we are completely imposed the lockdown, then definitely it will become very hardship to the people of our states. So we don't want to have any kind of hardship to our people.
Thus, Meghalaya have a plan of action in case the situation worsens. Meghalaya Chief Minister Conrad K. Sangma on April 21st said, unlike last year where the situation was new and unknown to the government, an economic shutdown was imposed. But this time, the government is more focused on restrictions and precautions. But if the situation goes from bad to worse, then activating the Economic Task Force will be looked into.
Economic Task Force is, of course, something that we've always now kept it in our mind, and that is the reason why we are not very keen to immediately go for a lockdown. And if situation gets from bad to worse, we will look into the aspect of the economic lockdown or any other kind of situation, and an economic panel or whatever is required. But that situation, we are hopeful that with these measures of vaccination and with the measures of restriction, we hope that we'll be able to control the situation to a large extent.
See, that we also have into consideration, understanding about the problem of the people who are, having the business community and also who's dependent from the tourism. But we have to see first which is the priority. Health is the most priority than the other thing, but the other also is equal important. But we have to take care first, it should not happen anything to the citizen of our states.
Are we looking at another lockdown? Meghalaya Chief Minister Conrad K. Sangma had earlier stated that the state is not going for any lockdown, but certain restrictions have been imposed to curb the spread of the virus. Prime Minister Narendra Modi had on April 20th also stated that lockdown is not the option. Government stresses on intensive and extensive vaccination drive. Giving prominence to COVID-19 vaccination, health officials said that the vaccination drive would start from Shillong and move out to other parts of Meghalaya. And starting May 1st, even citizens above the age of 18 years can avail the vaccine.
I have taken the injection first shot myself, and almost close to 1.5 lakh people in the state have taken, and there have been no reports of any kind of reaction to the vaccination that's there. So therefore it's absolutely safe. We have close to 6.5 lakh people in the state who are above the age of 45. So therefore the target is not very big. And we have discussed this since yesterday, and we are determined to finish all the 6.5 lakhs within the next 1 week.
See, now we are going to take a massive drive for the vaccinations. Okay, we understand that we have, now at present we don't have any shortfall of vaccination. But later when we had started the massive way, the drive, then we will be having the shortfall. But that also we have prepared. Yesterday we took the review meeting. We have already informed the head of the department, anything which is related for fighting the COVID, it cannot be compromised.
There is a pertinent question that was raised in respect to vaccination. Are vaccinated individuals immune to the virus? The answer is no, and Dr. Andreas explains why.
It doesn't mean that you have got vaccination, you won't get infected. That's why I think some of us who have got vaccination may think that I won't get infection. No, you may still get the infections, but the severity of the disease will be less. Meaning is, you may get the infections, but hospitalization or admission in the hospital will be less, or maybe your chance of going to ICU may be. I think wearing masks is very important. We should encourage all the people, the children, and then of course hand washing. Okay, after touching anything which you think it's contaminated, or especially like public toilets and all these things, you should frequently wash your hands. And number 3, of course, social distancing. So I would advise them that at least even in public places like church and other temples and all, people should maintain social distancing, masks and hand washing. It will not prevent you from disease directly, but at least it will prevent you from the severity of the disease. Who knows, after with few research, after a few days or after a few years, it may show that it's preventing the disease also. So I will encourage the publics to take the vaccination.
We have to maintain the protocol. It is for your safety, for the safety of your family. This is a must, and it's a priority to maintain the protocol.
Let us fight this virus together. It starts with you and me. Stay safe, stay protected, and always follow the 3 basic things: that wear your mask, wash your hands, and maintain social distancing. For more updates, make sure to subscribe to TNT-The Northeast Today.